Today's video, we're going over manual muscle testing for the hip. Push, 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 you weak piece of shit. So why do we care about hip strength testing? Well, it's pretty well established in the knee, particularly after ACL reconstruction, that knowing the strength of your quadricep particularly, but also the hamstring, is going to be important for a variety of things, like return to sport, but also criteria-based progression from a rehab perspective. Measuring hip strength is probably just as important as the knee, although it's just not as common. Think about your common hip surgeries like hip labral repair, PAO, and hip replacement. We probably also want to measure strength and make sure that's progressing over the course of time. We can also use some of these strength numbers for criteria-based progressions. So think about your post-op hip labral repairs. If we're 70 to 80% LSI on hip abduction extension, maybe we're ready for running, just like we look at the quad to be ready to start running ACL reconstruction. Also, just like in the ACL, we can use the hip strength as a guide to figure out if your patient is ready for return to sport. Maybe we want to see somewhere between 90 and 100% symmetry before we consider sending our athletes back. And lastly, we also know that the hip gets weak after other injuries to different parts of the body, the big ones being something like patellofemoral pain, as well as lateral ankle sprains. So after your athletes get injured with these particular injuries, probably want to assess the hip and make sure we bring that hip strength back up before returning back. So in today's video, I'm going to teach you my favorite way to measure hip strength in my hip patients. What's going on, guys? My name is Dan Pope. I'm a physical therapist and a strength coach. I'm for fitnesspainfree.com. We've helped to make thousands of incredible coaches and clinicians through online courses, communities, and mentoring programs. Goal of today's video is to make you 1% better. All right, so what dynamometer are we going to be using today? This is a Vald Dynamo. It is a push dynamometer. You can also take these off and put tension links on it. And essentially, you can also pull it apart. Now we're gonna be using both of these functions today, but you can use whatever dynamometer works well for you. If you have a good one you really like, let me know in the comments below. We're gonna be going over measuring 4 directions of the hip today. So we're gonna have flexion or moving up, we're gonna have extension, moving backwards, we're gonna have abduction to the side, adduction going across the body. And here's the thing. You can make the argument that maybe you want to measure hip external rotation, internal rotation. I just think when you measure 4 sides of the hip, you're probably going to be picking up some of these deficits. But if you're working with a golfer or some sort of rotary athlete, maybe it makes sense to try to measure that too.
Hey there, Broseph McJoseph. I hope you like treats. Evidence-based treats, that is. It's an evidence-based cheat sheet for diagnosing and treating femoral acetabular impingement. Now, not everybody loves searing hip pain right through the front of the hip as much as I do. And if you want to make any money as a physical therapist, you're going to have to help patients with this type of hip pain. Trouble is, got to stay up to date on this condition to know how to treat it properly. And that's where I come in. With this handy-dandy little cheat sheet, we'll catch you up to date on the medical literature on femoral acetabular impingement syndrome in under 10 minutes. We go over a lot of good stuff. Definitions, prevalence, incidence, population, anatomy, risk factors, pathophysiology, mechanism of injury, clinical examination, differential diagnosis, and treatments like physical therapy, injections, and surgery. Best of all, this is a free download. I'll leave a link in the description. Go ahead and download it and get your learn on. And now back to this video.
The first measurement we're going to take is going to be abduction. So essentially you have your patient laying on her side. Joe's got his knee bent to 90 degrees. He's comfortable. The other piece I want to do is make sure that we're right about in plane of the hip. I don't want to be sitting in adduction or abduction when I measure this. Consistency is going to be very important from test to test. If the first test at week 1, I test him here. Second test, I test him right here. We're going to get 2 different numbers. It's not going to be valid, right? We also have to be very consistent about where we place the dynamometer. So essentially, I'm going to feel for the lateral malleolus and go just above that. And every single time I measure in the future, I want to be just above that, right? The second piece is that these are going to be make tests, not break tests. So I don't want to have Joe bring his hip here and push down as hard as I can and bring his leg down to the table. I essentially want to be a statue. I'm going to put the dynamometer right here, and I want to be in a movable wall. He's going to push as hard as he can into the dynamometer, and when he's finished up, he relaxes, okay? The other piece, I want to stop the test if there's any sort of compensation. So if I notice that when Joe starts to push, after a while he starts to turn his toe up, he's getting his hip flexor involved, that's no good. We're going to stop the test. That's not valid information, all right? So let's go ahead and do the test right here. I like to get on top of the table because it makes me nice and stable. I can make sure that when he's pushing me, I don't rise up in the air, right? So if Joe starts to lift me up, if he's incredibly strong in his glute medius, it's not going to be a valid measurement of his strength. So we have to make sure that as he pushes into me, I don't start to lose it and get pushed back up again, all right? So generally speaking, we do one warm up, you push it into me a little bit, gets an idea of how it goes, and then for the second test, I'm gonna have you ramp into me slowly here, Joe, and then push, 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 and then relax, okay? Now, one of the things you may notice is I was yelling at Joe. And the reason being is we want to give some encouragement because that's going to greatly change the results we get. If I yell at Joe, you can oftentimes see 10, 15, 20% difference compared to not saying anything, all right? And again, consistency is key. So if I yell at Joe the first time, the second time I don't, he looks weaker the second time, just might be because I gave him more encouragement on the first. Next, we're going to measure adduction. I have Joe lying on his back here. We're going to bend the knee to 90. Hips in about 40 degrees of hip flexion. Just keep in mind that's got to be consistent from test to test. In terms of where I put the dynamometer, I'm essentially putting it right at the knee. I like to go proximal to the joint line, so right about here, right? So just like before, I'm on a movable wall, making sure that I can keep here and not move as Joe pushes into me. Joe's also going to grab onto the sides of the table so he's nice and strong. Go ahead and ramp into this a little bit of pressure, then push, 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 and then relaxing. Next, we have hip flexion. So I have Joe at the edge of the table. His feet are gonna be hanging off the edge. From here, he sits up nice and tall. I wanna make sure he holds on the side of the table so he can produce a lot of force. And from here, I like to put a step so I'm nice and tall and I get over top of Joe's knee. So if I'm staying on the edge and he pushes up, chances are my triceps aren't strong enough to control him. But if I get over top of him, straighten out my arms, now I feel nice and strong. Believe it or not, hip flexors are pretty dang strong, and oftentimes you need something to stand on in order to get a good measurement. So from here, take my dynamometer, I'm gonna be directly over top of the knee. Go ahead and push into me lightly here, Joe, and then push, 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 push. Good job. All right, bit of a wonky setup, but this is my favorite way to measure hip extension. So essentially we have a chain attached to this rig here. It's not moving whatsoever. Chain goes down to the dynamo, which is going to measure the force that's being produced by Joe. And from here, Joe's laying on something stable. You can use a table in your clinic. And then essentially we have a strap that goes around the knee, attaches to the dynamo, and the goal is to have the hip at 90 degrees, so make sure you get your goniometers out. We're going to be consistent from test to test. From here, Joe can push as hard as he likes, which is really nice, because one of the problems when you're trying to measure someone's hip extension strength, most folks aren't strong enough in order to record that. But unless Joe can break through this chain, we're going to get some good data here. So same exact setup as before in terms of ramping slowly into the resistance. Go ahead and push a little bit, Joe. And then push, 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 push. You get a great measurement there. All right, so you got the data. What do you do with it? Obviously, we compare left to right to get our LSI numbers. And from there, we can make decisions about how we're going to program for that athlete. So if we're trying to get close to 100%, we notice we're weak in any particular direction, obviously you want to strengthen that. One of the things I like to do is if we're really weak in one direction, let's say the hip flexion is really weak, the hip abduction is very strong, I actually back off of the abduction exercises and I ramp up the hip flexion exercises. You can also take some of this data and compare it to norms. Let's say you have a distance runner and you're measuring the side of the hip and you're not sure whether or not they're strong or they're weak. There are some studies out there. We can take a look at the average runner and see what their hip abduction strength is. The problem is every study is going to look and measure its strength differently. So you want to make sure that you're measuring your athlete's hip strength in the same way they do at the study. Because if you take the numbers based on the test that I love, try to compare it against a study where they can measure it completely different, you're not going to get the answers that you want. All right, you got your hip measurements. Let's say the hip flexors are very weak. Well, we got to strength train them. And guess what? Joe and I, we have a video for you. It's up in the corner. Go ahead and click on that link. I'll go over my favorite hip flexor strengthening exercises. See you there.